in here. There we go. All right.
Got it. Sorry, I paused it when we were talking in the beginning.
We are recording the meeting for the to be posted in the public. So if you are a work group member at this time, if you could just type your name in the chat for roll call attendance. And once and if we get a quorum, we'll conduct some official business with respect to the minutes, and Haley will keep track of that for us.
Yeah, we might need to go back around to the minutes because I don't think we have quorum yet.
Yeah. Okay, so let's jump. I'll just say there's three topics tonight. There's a discussion around the carryover funds, and Matt's going to speak to those. Then we have a larger chunk of time around legislative conversation, and then we'll close out with a wrap up of where we are with the data dashboard work, and then we'll have public comment. So there's the three larger chunks of time, and then the public comment, as we know, is always at the end. Members of the public, while it's a pretty free-flowing and engaging conversation, using the chat, we do reserve the 10 minutes at the end for anybody in the public to speak for 3 minutes to share their thoughts about the work or what they're hearing in the conversation. That said, I think we're definitely not going to be at a quorum just by looking at the screen here. Since everybody fits on one screen, I think we can move over the minutes from the last meeting to get approved and go into the first topic. Is carryover fund and FY23 funds and the RFP timeline. Matt, we're going to turn it over to you to kind of walk us through this narrative.
I'll run you through it since you told me I should keep it short.
I didn't say that. I didn't say short. I did not.
Okay. Good afternoon, everyone. There's two sets of funds that we are talking about. One is funds for the current fiscal year that were not completely exhausted from the bids that were received for the two projects that for which the major RFPs went out, those being the pre-K early childhood program and the wraparound services wellness center program. So for both of those programs, the funds that were appropriated last year weren't necessary to meet the bids that were received. So there are additional funds that are available for the bids that will be going out for funds that are in the FY23 budget, the one that the legislature is going to vote on in June. There's a lot of activity on that front, all for very good reasons, which is that the governor, to his credit, put almost all of the funds that are dedicated in the proposed budget for next year into the operating budget rather than using one-time funds to pay for it. And what that is allowing the Department of Education to do on both fronts, early childhood and the wraparound services, is to put out RFPs or RFAs that have a 3-year time period rather than a 1-year time period. And I think we had discussed at a prior meeting that potential bidders for the RFPs that went out last year had some hesitation about whether to bid and how ambitious to be, because it was primarily one-time funding, and there was a concern that they would invest a lot in a program and then the money would go away after a year. So the fact that the money is now in the operating budget and that gives the Department of Education enough confidence to put out 3-year RFPs is a great development. And it means that we hopefully should have more providers, more schools that are responding to the RFPs when they go out. And also that the programs that they propose, we hope will also be more expansive, because they can have some confidence that this is going to be an ongoing program. So where we are in the process right now is that the Department of Education is looking to actually ideally put out the RFPs before the budget gets passed, because you may remember that there were some time crunches caused last year by the fact that they didn't come out until the summertime. So they are working backwards in both instances from epilogue language that Senator Lockman has told them she's going to ask to have included in the budget bill when it gets passed. And they're working to try to match up the RFPs with what she has told them the budget epilogue language is going to be. So that process is underway. We're hopeful that the RFPs are going to be going out in the relatively near future. And again, it's just it's a great position to be in compared to where we were last year. And just circling back, the money that is carried over from this year's budget in both cases is going to be made available to bidders for this year's RFP for initial one-time costs that they might have to incur in order to be able to successfully bid. So for early childhood, the goal is that if there's a provider that would like to submit a bid but would need to make some sort of modifications to its physical plant or something else that would otherwise meet the requirements of the RFP, that some of these carryover funds would be available in order for them to be able to do that. And likewise, with respect to the wraparound services, one of the requirements for bidding on the wraparound services is that there be a wellness center component included in the bid. And there are some eligible schools that already have wellness centers set up in their schools and others that don't. And for the ones that don't, there are some capital costs that are involved in modifying a school to have a wellness center. So some of those carryover funds will be available to schools that want to bid, have great program ideas, but would need that extra help to be able to modify a classroom or modify a nurse's office to make it appropriate to serve as a wellness center. So that's I don't know if I went over my 5 minutes or not, but that's where we stand. And again, compared to where we were this time a year ago, things are great as far as the recommendations that our committee made.
I would agree, Matt. I think that the 3-year in the operating will make a bigger difference in the people going after the bid to get involved in this work because of the sustainability of it. So I think that is, it's good to see a lesson learned and that there was a change made to support the work structurally within the process. So I think that's great. Did anybody have any questions for Matt? I didn't see any coming to the chat specifically around these topics. Great. Thanks, Matt.
Thanks.
So the next topic on the agenda is a legislative discussion, and this is obviously a loaded time to have that discussion since there's a lot of legislation going around and there's a lot of conversations going around. And so we, Ray and myself and Haley, spent a significant amount of time trying to figure out how we would bring this conversation forward to the work group, and then how we would bring something back to the full body consortium meeting on June 2nd that would make sense to the work that we've been doing in the social determinants work group, trying to keep the legislative conversation around those topics, not the broad range of topics that are out there in the legislative tracker or whatever system you're using to monitor bill and or past legislation status. We came away with what we hope will be an effective and balanced and streamlined process to have these conversations and decisions brought forward. Ray, did I miss anything about what got us to this point in terms of how we're thinking about structuring this conversation? Is this your understanding of where we're headed for the next 30, 40 minutes?
Yes. So as Jeff has already alluded to, each piece of legislation is in a different stage of development. So we focus on those pieces that align with social determinants work group initiatives. There are other pieces of legislation related to educators and educator diversity and student loans. We did not include that, although that I'm just giving that as an example. Mm-hmm. It's very important. That's more of the focus of the educator work group. So as we move through, we just want to have you all weigh in. Is this a piece of legislation we should be tracking? And if that piece of legislation, if the answer is affirmative, if that piece of legislation needs support, additional support, then we will share that with the full rating consortium. Is that where we're going?
Yeah, I think that captures it great, Ray. I think it was great to give the example of the delineation of what conversations we had around what we tried to bring forward. That was as the moment in time that we knew was out there and in some state, and some of them, to Ray's point, we're not sure where they may be currently, or if they're moved past whatever we saw on the legislative tracker, I think about a week ago. So what's going to happen is we're going to bring up 2 pieces of legislation per slide, just to give you structurally the way this is going to move forward. And we're going to allow a little bit of an open, if someone has feedback on one of the 2 pieces of legislation that's on the slide, like where it is and what it needs right now, we would value that from the room. We did invite a lot of folks to come here to kind of share any current updates that they have, so that we could be as informed as possible. I think we're really fortunate. We have, Kristen Dwyer in the room. No pressure, Kristen, but I mean, I know you, of anyone in here, is going to be attuned to much of what you're about to see on the slides. And then I see Yvette here, who also I know has been involved in some of these works. And I believe we might get Kelly from you. Oh, no, that's for a later conversation. So
Caitlin Gleason.
Caitlin Gleason's here from DOE. That's right. All right. Thank you, Caitlin, for being here.
And Dr. Terry Lawler.
Yeah, she's as part of the work group. And I don't see anybody else that we may have reached out to. So that said, let's try the first slide, see how it goes. We have roughly 6 slides, 2 topics, 2 bills per slide. And, we did allow a fair amount of time for this process because it was, tasked from the full body consortium and the chairs that they're, to kind of gather this information. So we did want to give it as much attention as possible. That said, we have 2 bills up on here, HB 129, school-based health centers in high needs elementary schools, and then House Substitute 1 for House Bill 144, funding for pre-K special education. You can see the current status, and this is us pulling right from the legislative tracker. So I'm not sure if this is current or if there's.
I updated them today, Jeff.
Oh, you did update them today? Okay, great.
Yep.
Thoughts on these 2 pieces of legislation from this work group in terms of a stance or any update?
I don't have an update on that, Jeff, for HB 129. If it's in appropriations, it's this committee hearing takes place in the next 12 days. Perhaps it might be good to have people lined up to deliver public comment in support of this. So, if there isn't, if that has not been identified, perhaps that'd be the next part in executing on the strategy, just to make sure this gets all the necessary supports.
Okay, so say that, Kristen, go ahead. I see your hand go up.
Sorry, I was just a little confused. Does it have a committee hearing, Yvette? Or are you trying to work it out through markup?
I don't know. It just has on here what happens next. Committee hearing takes place. So I don't know if that's been scheduled.
That's just
I don't know if it made it out, if it's still in appropriations or not.
Yeah, so we're at a point now where they most likely won't have committee hearings for bills that have fiscal notes. What they're doing with one of mine, for instance, is they are walking it around. But it's really the conversations that are happening kind of behind doors regarding what's going to get funded in the operating budget, and, kind of that coming out during markup next week. I think it's next week and the week after. Okay. So I think what we should do is just get with Kim Williams to see where it is on the priority list of joint finance members, and to see if there's some way we could give it an extra push.
All right. Thank you for that, Kristen. Background, like where things are and what's going on.
But we're also tonight, we're deciding if we are asking the full consortium to support pieces of legislation, correct?
Correct. That's going to be the poll when we get, this is good for us to kind of, Haley's taking notes, like where we can go from here to get more intimate detail about what we can do to advocate for. But then there is the poll that we're going to take. We're going to ask the members of the consortium who are here tonight, or the members of the work group who are here tonight, to vote in the poll to kind of give us an idea of whether or not we should consider it to bring forward June 2nd to the full body for support. Any other, the other one is also in appropriations. Would that same principle apply, Kristen, that you described for that as well? Okay,
Yeah, it's just, I mean, markup is next week. So,
yeah,
I mean, if they haven't had a hearing for it, they're not going to have a hearing for it.
Okay.
So just kind of checking in and seeing where it's falling. DFAC was good today. I mean, these are both
okay,
budget bills. So we were up roughly, I want to say 187 million since the April
okay.
meeting. So we're up well over 700 million. And they're not necessarily revenue streams that are one time like a sheet, like they're coming from PIT and corporate income tax. So, but there are people on DFAC that are saying like the reason why we're having these bumps is a one-time occurrence and not something we should be reliant on. But the point of it is that they're more ongoing revenue streams rather than like, a boom from a sheet, like a $400 million drop from a sheet that just hasn't happened.
Okay, great.
I have a question. So if we have members of the public who want to provide public comment prior to us voting, it would make sense to have maybe people who are here to support the work that we're doing speak, even if it's for a minute. That way we hear from them before we poll.
I'm trying to think.
I think, thank you for that, Dawn. I think it would be very helpful for people in the public to use the chat, whether they're suggesting that this be elevated to the full Reading Consortium and whatever else needs to happen, and before June the 2nd, since markup is next week.
Okay, that's a good point. Thanks, Ray.
So I'm monitoring the chat.
Okay.
Well, these are bills that I hope that we will agree to choose to even vote on the bills. I mean, because they're in the poll, are we saying we're voting on them, or are we even deciding if we are going to vote on them?
No, there is a poll for each.
And
piece of
Haley
legislation.
will push the poll out as soon as we kind of like pin any further discussion around it, and then then we'll do our responses. This is our first time doing this, Dawn, so got to let it work us through it.
Understood. Well, certainly as an early childhood special educator, I hope that I ask that members support HB 144. One teacher to every 12.8 students does not meet licensing ratios, nor does it meet dollar stars ratios, and it's not best practice. So I would ask that the other members support that piece of legislation.
One thing I'm going to just say before we vote, I feel like many of our meetings since the fall, we've had people coming forward talking about current things or legislation or topics that were relevant to our work group. Some of these things aren't totally foreign to us in terms of our understanding of them. And I feel like as I reflect back on this year's meetings, perhaps it would have been a more efficient way or a wiser way to do this is at the time of those presentations, kind of gauge these conversations then. So we're not at the last minute trying to do this. Because we did have Yvette present on a couple of, I think it was Representative Griffin, came forward and presented on some of these things. Dawn, you've talked about this. Kim has talked about we've talked about these, I feel like we've talked about this. And so I feel like moving forward, we need to do a better job of capturing the sentiment of the work group so that we're not at this point. So I just want to share that as a reflection. So I don't think any of these things are going to be foreign topics to this group, because we have been having a lot of conversation around it in this space, just not formally as it relates to supporting or endorsing. All right, Haley, let's give this a whirl. Stick the first poll in there.
Excuse me, there is a question in the chat. Maybe
Okay.
perhaps, Dawn, maybe you can answer this question. The question is, well, it's to everyone. Do you see that question? How much does HB 144 provide in funding for children with special needs? And is it for K-12 Or
No,
does it?
so I'm glad that you asked that, Julie. It actually came up at a meeting that we had earlier today. So I'm glad that you asked. So the ratio would become the same as K-12. So right now the ratio is 12.8 children per teacher for 2, 3, and 4-year-olds. So the ratio would lower to equal the K to 12 special education basic special education ratio of 8.4 and 1 to 7 for 2-year-olds. And this would allow not only better funding for or more support for the programs that are in district buildings, but I think it's really important to understand that the community programs with whom we partner would be better supported because itinerant service providers would have a lower caseload. So that would allow itinerant service providers to better support Kingswood, our Head Starts. I see Lucinda here, St. Michael's. So those of you who are receiving itinerant services, I know Trish, you asked, put a question in there, Trish Dallas, though she is an itinerant teacher. So having a caseload that's smaller means that she can provide better or longer services to children who are out in the community. So children would not necessarily have to come into a district program. They could instead stay where they are because that's federal law. That's federal and state law of FAPE. It's free to appropriate public education, but it's also the least restrictive environment. We want kids to be able to stay in that least restrictive environment if they can.
Thank you, Dawn.
Should I go ahead and launch the poll?
Yeah, let's go ahead and launch the poll.
Alrighty, I'm gonna launch and please let me know if you can see it on your screen.
Yes.
Great. And please only work group members respond. Sorry for members of the public. We really appreciate your comments, but it's most helpful when work group members respond. All right, it looks like that should be everyone. And we got, all right, I'll end the poll now. And I will share the results. Can everyone see that?
Yes.
All right, great. So 100% yes for both.
Good. All right, thanks. All right. Let's take a look at the second slide. HB 294, oral health examinations, and HB 300, mental health services in middle school. I can speak, I think, to House Bill 294. I believe that Colonial School District is going to be piloting or is going to be experimenting with a program with DSC around this process for a year to gather data, and then possibly a second year of the pilot to implement from that before Senator Williams brings it out. Dawn, am I right? I can't remember the timing of that, but I remember John Cooper, one of our directors, talking about that.
Thank you, Dr. Menzer. So the initial rollout of doing it statewide, the challenge is that the data from public health does not easily upload into health accounting, which is what our school nurses use.
Mhm.
So we are trying a pilot with Data Service Center to bring the data together from DHSS or DPH to
Right.
DOE.
Okay.
So yes, the goal is to pilot it first.
Okay, great. So that's the one we will not be voting on tonight.
Just to share with the group, our school nurses, there's a school nurses association, actually has a lot of concerns with this bill. It increases their workload, and they're at a point now where their workload is pretty heavy. So we have to work with them and work with Representative Williams on how this could be rolled out without putting so much work on their plates.
I think our nurses were.
And that's the point of the pilot, is that the data would not, because the nurses don't do the screening, it's DPH. So with this data pilot, the nurses would not have to input any data. It would all flow from DPH when the pilot is working successfully.
Yeah. Kristen,
Just
our nurses.
The legislation's written differently than that. That's the thing. So.
And I think I know we've talked about this, Kristen, and I think our goal is to get where you're describing and what Dawn is explaining. So I think by doing the pilot, we're going to be allowed to work through some ins and outs of the data communication, because the goal is for the nurses to not have to do what you're describing. HB 300, mental health services in middle schools. I'm probably pretty sure Kristen can give us it's the same thing. It says it's in-house appropriations, and I guess we're in the same situation with that.
House Bill 300 extends House Bill 100 into middle schools. So the only major change in the legislation is it removes elementary schools and it puts in middle schools. So it has a very large fiscal note, as House Bill 100 did. But it's just kind of this effect that we saw, like, not only is it needed in elementary schools, the funding's needed in middle schools. And Representative Longhurst is adamant and working towards getting it funded.
Any questions?
Well, I just want to add that this is legislation that the department is very happy about. More importantly, to have the fiscal note to go along with it, because in the past we've had the legislation, but we have not had the ability to really implement strategically. This allows us to think more comprehensively about how we get more mental health professionals into the field and create a pipeline so that we can not only have the legislation for the services, but actually have practitioners to implement.
Thanks, Terry. Any other comments by consortium members or work group members? Again, members of the public, if you want to weigh in, please definitely put it in the chat. And if there is a question, please put it in there. All right. That said, Haley, let's do poll number 2.
All right, launch it right now. Can everyone see that?
Yes, I can. Shouldn't speak for everyone.
Okay. I'll leave it open for just a little bit longer. All right, I'm gonna end it. I'll share the results. Can everyone see that?
Yes,
Yes.
great.
Okay, great. 100%.
Next slide. HB 301 is mental health programs, and HB 303 is annual behavioral health well check. These all three flow together. Let's see. Kristen, can you explain what the word ready list, what does that mean? Because we saw that in these legislative notes and we were not sure what did that actually mean.
It's just, ready to go on the Senate or House agenda. So like there's a line of bills that leadership in the caucuses will decide what goes on the agenda.
Okay.
So sometimes though, it may be on the ready list forever. So you may just want to push and nudge and get it on an agenda. So.
Okay. Do you have any, I know you worked a lot with Val on some of the mental health bills that she's done. Do you have any insight into 301 that you might want, that you could share with the group?
Could I actually ask Terry Lawler if you want to tackle 301, Terry, or and I can do 303.
Yeah, great.
Again, very much in support of making mental health services available more broadly. In this particular case, what I am hoping is that we'll establish a very goal-oriented task force to provide some guidance on what this is going to look like on the ground. Because as you know, while the Department of Ed certainly provides guidance, we do not go in and legislate curriculum for districts. And so being able to have some information to support best practice identification, what what this, the particular mental health program will or should look like, I think it's going to be helpful. And that's a place where the department can really be helpful there. But we are very much in support.
Hey, Jeff, I just wanted to jump in. We do have a quorum if we wanted to take a vote on the minutes.
Yeah, you know what,
Well, that-
before,
Can we just keep moving?
Yeah.
I'm very linear. I apologize.
yeah,
Sure.
we can get
Do it
through
at the
it.
end.
Is if someone's going to leave, let us know. That'd be the only way we'll get
We can
Ray's
also do
not.
it at the next meeting as well. It's not,
No,
Okay.
I think, yeah, if anybody is going to leave before we finish, let us know so we can switch, but because
Yeah.
we have how many more legislative items to go through?
3 more slides.
Oh, okay, let's keep it moving and let's
Okay.
try to get there.
Okay. All right. Terry, anything else you wanted to add to that before we move?
So I put a question in the chat.
Yeah, I saw that. Not about 301, but for 303. So, Ray, it's a good question, but the local funds, first of all, with House Bill, oh my gosh, I can't have blanking on the number, 308, for MTSS last year. So MTSS legislation launched July 1. And with that, there's a lot of support around universal screening. And so when thinking about the behavioral health well check, that sounds like a screening opportunity, and that those decisions would be made at the local level.
Actually,
So
so can I talk to 303 just a little bit? It's actually more of a it's more of an insurance bill than a screening bill, like Terry says. It does this, the behavioral health check is like a wellness check, a well visit check for kids. So, I take my kids to get a well check. It's covered by insurance. I don't pay a copay. This would be similar, just like you go for a
Okay.
physical well check, you would be going for a behavioral health well check. So House
Okay.
Bill 303 actually does have a fiscal note to it because, Ray, you mentioned the state insurance. No, we do not cover behavioral health checks like we do cover well checks. Neither does Medicaid at the moment, so that there would be a cost to that. And then, your private insurance, obviously, there would probably maybe be some premiums for people who are outside Medicaid and outside the state insurance. So it's actually more of an insurance bill than it is kind of an education bill, but it would be the same type of visit like you would doing a well visit for your kid. You would do a behavioral health visit for your kiddo. So the reason why it has a fiscal note is because we'd have to provide coverage for that in our insurance plan as well as in Medicaid.
Thank you.
Yeah.
Thanks for the clarification, Kristen.
And I just want to add that what's really neat about that is it gives some sustainability for Project Thrive, which is, I think I talked to you guys about that in the presentation a few months ago, but that's the state's trauma recovery demonstration grant that funds mental health support. And so for a grant that's going to end, that funding's going to end in 2 years, this allows us to know that kids will still have access to those supports.
Mhm.
Great.
Thank you both. So I think we're ready for the poll if there, I don't
Yep.
see any other,
No, I don't see any other hands up or the chat. Any comments from the public? So let's launch the poll.
all right. Launched. All right. I think that's everyone. Those are the results.
Great.
Great, thank you.
Okay, this is the one that I believe we had a presentation on in the fall, or was it early? I know we had a presentation on this and we had pretty lengthy discussion in Q&A. House Bill 400. And Yvette, I know this was one that you brought forward to us and have been bringing forward to us. So did you want to give us where is this
Yes, yep. So HB 400, this is the bill that would suppress the explanation of benefits. So essentially, this is a key sustainability strategy for school-based health centers. Many of us know that that for a number of years we were working to get legislation passed on this, specifically because for sensitive healthcare services, providers cannot bill for those services because the explanation of benefits would go home, which would then compromise the confidentiality of a patient. So essentially HB 400 does this. Representative Griffith was on the call. I think it was in our last meeting, as she had done the overview. And I know that school-based health centers is one of our priorities. So it was important for us to get behind this. Now a number of us testified before the Economic Development Committee. I guess that was a couple of weeks ago. I know Kristen testified, I testified, and made it out of committee. I'm not really sure where it is right now, but I think it may have gone to the full House floor. I'm not exactly sure. Kristen may know. But nonetheless, this is certainly one of those bills that would help to amplify and provide access to services, to our kids. And then Kristen, if I missed anything, feel free to chime in.
I see Senator Sokola has his hand raised.
Yeah,
Yeah, I think this does not only apply to school-based health centers. I think
Correct.
it also applies to circumstance. And so, for instance, a battered spouse or someone who's going for mental health services, that wouldn't come in, and that because there have been circumstances where that's caused, an acceleration of that kind of behavior that led to the need for the mental health services or whatever in the first place. And so it is fairly broad. It does not authorize any health service that is not already authorized. And it does not authorize it under any circumstances under which those services are already authorized. That's how it's been explained to me. And I think that is a reasonably accurate summary of what it does.
Yeah, you're right, Senator Sokola. And I only mentioned the school-based health centers was really good for this group. I mean, that's really where the impacts are, but you're absolutely right. It does cover those other sensitive services. It's not just for school-based health centers, but it does help to create access and protections to patients that perhaps have been victims of other incidents and, certainly don't want, that explanation of benefits to compromise or jeopardize that confidentiality.
thank you for the clarification, Yvette and Senator Sokola. Appreciate it. Ray, did you see any questions in the chat? Any other comments from work group members? Okay, that said, Haley, you want to launch the poll?
Yep. All right, looks like everyone responded. Again, 100%, great.
Okay. Okay. We'll just go with the first one on the slide, House Substitute 1 for House Bill 377, early childhood education. It's out of committee on the ready list. I'm pretty certain Dawn or Caitlin are going to be able to speak to this if there's any, to provide some context beyond what we might already have in front of us. So I defer the floor to either one of you to kind of share.
Dawn, as a committee member, would you like to start? Happy to fill in.
No, go right ahead, Caitlin. I've said a lot tonight, so you go ahead. I'm happy to talk about it, but I'll give you a turn. Thank you.
And so as the synopsis rightly states, this bill is to conduct a workforce study. It's done annually, starting November 15th, 2022, to be able to collect data on the workforce for early childhood professionals. We currently do not collect enough to be able to answer many of the questions we have in order to support our workforce fully. So the intention of this bill is to provide that data for the Department of Education to create a plan by January 31st. There are considerations for implementation of the plan that are outlined in the bill as well, wraparound supports for professionals. And it really, we do support the idea of having this more aligned support system based on data and making decisions from there. So that happy to expand further if folks have questions.
That's great. The fact that Dawn deferred the floor to you, I'm going to bring you to more of my meetings.
I did invite her to start.
I do have a question, Caitlin. Is there a fiscal note?
So right now, the collection of data is actually something the department is working on. So it's included in our existing budget. Creating the plan is also aligned with the timeline is aligned with the department's strategic planning efforts for early childhood. I think that, and because again, it's a plan to consider these different systems of supports, there will be a fiscal note for implementing the systems of supports. So that is something to consider not in this fiscal year, but in fiscal year 24.
Thank you. So
Thank
the
you.
implementation of plan based on the data. with
That's correct.
the resources. Gotcha. Thank you.
That's correct.
Let me check the chat. Good. All right, let's go down to the HB 304 reading competency. I believe this is on the agenda tomorrow in the Senate Education hearing. Is it tomorrow? Wednesday, I believe. Is that right?
Is Senator Sokola still on?
Yep.
Oh, this is a House bill.
It's a House bill, but it's
I
in
know,
Senate
I don't want to be
Education.
out of order. It's going to the Senate Education Committee for discussion, sir? Is that what's happening?
I believe that's where it is right now, based on what I saw this morning.
Its status says it's in the Senate Education Committee and it says 5/12, so that is probably when I assigned it to the Senate Education Committee. I could back up and look if you need.
That's okay. Perhaps you can answer my question. So I don't know how to, and first of all, I understand the importance of screening and multiple screenings in a year. Does this need for this legislation imply that there are schools that are not doing K through 3 screening, reading screenings already?
I'm looking on the bill right now to see if there's anything in either the synopsis or but if they are not, sometimes when there's a piece of legislation like this, it's because there's word out that somebody's not doing what they think that it ought to be done. And so this becomes a checklist item, which is not always a great thing, because you can go through and you can dot your I's and cross your T's and check something off, but that doesn't necessarily mean you're doing a quality job of checking something off. So I agreed to co-sponsor this bill. I've been frustrated for so long that we've talked about focusing on reading and reading comprehensive and making sure that all kids can learn to read by 3rd grade. We haven't had results, and there are places around the country and around the world where they have. And so it's more out of frustration than anything else that I do. I think the Science of Reading bill, Senate Bill 4, that Senator Sturgeon brought forth, is a more important tool to have in the box, and it was amended and came back to the Senate, and I expect it to be going to the governor soon.
Okay, thank you very much. That's helpful. I understand better now.
If somebody's doing this well, they don't have to do it 3 times, right?
Right.
You know.
Okay.
Should I go ahead with the poll?
Yeah.
Did I miss it? Did it come up
Mm.
yet?
Nope, not yet.
Oh, 'cause-
Okay.
Just launched it.
okay.
All right. I'm going to end the poll and I'll share the results. So it looks like the majority voted yes for both bills.
Great. All right.
If I could just put a note on House Bill 304, to specifically have the full body understand the amendment that was placed on it. I don't know if there's only one or two amendments, but recently an amendment was filed because there were concerns from K through 3 educators regarding, again, workload and the ability to do it during the day because they're taking loads and loads of work home with them each and every night. This would require a lot of additional work by those educators. And one major point that Representative Williams was really wonderful to add in is including an educator in the determination of the curriculum and the screenings that would be used within the amendment. So like to have teachers and other educators at the table was really welcomed by my organization. So.
Great. Thanks, Kristen, for the clarification. Okay. All right. House Bill 317, medical coverage program for all children in Delaware. This, we also received a presentation or a briefing on this one, like a preview of this one. We didn't like it the full, this was still in the development phase, I feel like, when Representative Griffith talked to us in the fall. So Yvette, I believe
Yeah.
you might be able to share some information on this one.
Yep. So HB 317 is the Cover All Delaware Children Act. And essentially what this is providing access to healthcare coverage for those kids that do not have healthcare coverage, regardless of citizenship status. So this really impacts our children that are undocumented. And so right now the bill is in appropriations. We have a full coalition that continues to work in advocating specifically with the members of JFC to get this included in the markup process because this is not part of the governor's recommended budget. There are some adjustments that we're making to the fiscal note. We're working closely with Representative Griffith on that. And we hope that we get this through to the finish line. So essentially it's just providing access to coverage for undocumented children.
I see Senator Sikola, you had your hand up.
Yes, just a little nuance here. When a bill goes to a committee, it has 12 legislative days, but if it gets out of the committee and has a fiscal note and then goes to appropriations, there is not a 12-day threshold on that. The Appropriations Committee can hold that until such time as the Joint Finance Committee has funded it, and then they'll let it out. So it's kind of a nuanced, insider issue. But I just wanted to make sure that whenever you see Appropriations Committee, that means it's already gotten through a committee in order to get there, unless it was originally assigned to Appropriations.
No, it went to the Health Committee in the House and it passed.
Yeah, that's what I thought.
Okay.
Absolutely.
Great.
And
Thank
so
you.
we're just
Very
waiting.
helpful.
We're just waiting. That's why we continue to work closely and trying to reach out to the members of the JFC because there is a fiscal note attached to that.
Dawn, did you have a question, comment?
I do, thank you. So certainly I support all children who are not covered to receive coverage. My question is regarding the community fund. So I know that in healthcare systems, there's money that has to be reinvested in the community. So how does that how does that work with this? Does that work together? It's not my area of expertise. So Yvette,
Yeah.
how does that work?
So yeah, so I mean, all hospitals, they do provide charity care. But this really gets to it. So that charity care is going to continue to be provided for families that can't pay for care. What this gets to the essence of is really around wellness and being able to access healthcare when a child actually needs the healthcare, and not when the situation has become an acute situation where the child would then have to go into, to the emergency department, right? And so this is really a much broader bill around being able to access a primary care and all of those wellness and prevention visits that are necessary for overall child health. But hospitals still will be responsible for that. They're still going to pay that charity care for those either uncompensated care or services that for some reason go unreimbursed.
That's very helpful. Thank you, Yvette.
Mm-hmm.
And if I just may add from, just the DSCA's point of view and why we decided to support House Bill 317, it was, one of those instances where you're taking this issue out of the hands of the hospital systems and, the people who are deciding what they want to cover, what they don't want to cover. And by creating a CHIP lookalike program specifically for these children, we can ensure that they're getting the health care that they need rather than leaving it up to, let's say a third party. So for us, it was a sustainable program to ensure that these kids will get the healthcare coverage that they need.
And, and this is really an investment for kids that are here. And so one of the things that I know as a member of the Cover All Kids Coalition, that this is really a public health crisis, and it's a humanitarian issue that all kids should be able to access healthcare coverage regardless of where they're from. We know that it reaps dividends and impacts in a positive way across all parts of our system in the broader state community.
If I'm not mistaken, Yvette, was there just an op-ed in Sunday's paper related to this bill?
Yes, there was. It was on behalf of the Cover All Kids Coalition. Yeah. And it was on Saturday morning. Yes.
Yeah. Okay.
I'm happy to share that if you want. If you guys want it, you can send it out.
You can send it to Haley. That's great. She can share it out. It was a well-written piece. A lot of organizations listed, as you stated.
What paper had it in on Saturday?
The News Journal.
They don't do it Saturday.
Delaware News Journal, in the print edition I read in the E format. I guess that's the only way to say it now. There's so many different ways to read a newspaper. So the next one, explaining what a House concurrent resolution is going to be beyond I know it means something where there was something done together, but House concurrent resolution 82, mental health services in Delaware schools. We have DOE part of this. I'll defer to anyone in the room who has knowledge of where this is and what's coming next for it.
Similar to what Caitlin said about early childhood, the department hasn't typically tracked down to the work with title level, how many psychologists, all of that is typically done at the district level, but so that we can better plan and make sure that we have the human resources that are needed. We are now being asked to track that information, that data, so that we can do some strategic planning.
It's also to understand what we've noticed from implementation, if you want to call it implementation. I think Jeff understands what I'm talking about.
I do.
Yeah, of House
I'll let
Bill
that
100.
word get used, but that's all right.
Right. Yeah. Of House Bill 100 is that, there's a lot of short-term funding for positions that are outlined in House Bill 100. And it was really trying to understand what's funding. It's in addition to what Terry said, but also trying to understand where the funding is coming from for the positions that exist currently and understanding the sustainability of that funding. Some of it may have been ARPA funds. Some of it may be grant funding. It's really trying to get a handle of, where's all this funding coming from. and to see where House Bill 100 is going to fit in.
Senator Sokol.
And I think it actually goes one step beyond that. It's asking for information about the healthcare workforce, and we may have funding, but there may not be people who are trained and certified to fill those positions. And so is that right, Kristen? I believe that was another issue.
Yep.
Concurrent resolutions don't go to committee. They are voted on, they go into the other chamber, and it'll probably be voted on tomorrow in the Senate. Sometimes they're voted on the same day in both chambers.
I wanted to say that, but I wasn't sure if I was right, if that was the only, like,
Yeah.
like the only thing that was different, so.
I know that's an issue we've talked about, whether it was in the context of this resolution or other issue, because there's been a lot of mental health discussion. And I think that was part of what was raised on this one.
I believe I also it's not maybe it's related to this bill, like with the workforce. I know Representative Longhurst has initiated a conversation around a pathway for this type of work, similar to a teacher pathway. I know she's reached out to some of the CTE folks and some of the educators who work in that space. So I would sense that this was probably connected to that in some way, shape, or form down the road.
It came out of a conversation that we had with the Department of Education earlier this year around examining what we have currently in the workforce, and as far as certifications and licensures are concerned for those types of positions, understanding the funding, and then how we can strategically, like Terry mentioned, how can the department really build out the workforce, like what preparation programs are going to be needed in our higher eds, what type of reciprocity can we offer that, from other states, just really trying to get a handle on it. We've already seen a lot, and DFAC actually mentioned it this afternoon, and I'm really curious to see if there's truth behind it. But folks in private sectors are working for the state, starting to come over and working in school districts in these types of positions. So just, this is a part of kind of understanding where everybody's going to be coming from or could potentially come from.
Great. Thanks, Kristen.
And Kristen, a part of that, I believe, correct me if I'm wrong, was the discussion where we're going to look at the current workforce to see who might have some additional licensure ability. So if there's, for example, a social studies teacher who's also certified as a counselor, we can redeploy.
Great.
Okay, I think
right.
we're ready for the poll.
Yep.
Sounds good. All right, I think everyone has responded. Oh, yeah, might have cut someone off. I don't think so. All right, can everyone see the results?
Yep.
Great.
Okay. All right.
That was the last, was that the last piece?
I think so. Haley, was that
Yep,
the
that
last?
was the last poll.
So
Okay.
Piece of legislation.
This has been very, very informative for me. I hope others found it informative as well. And a special note of gratitude to Haley for her preparation.
yes.
Thank you.
Yes, Haley put a lot of work into organizing us, but then organizing this for this part. So she was very helpful in organizing it. And thank you to those in the audience for your willingness to share your insights and your thoughts, both around the topics as well as the process. It's definitely a learning experience reading the legislative tracker. That's all I can say.
So let's go to circle back to approve the minutes.
Yep,
March. I don't believe we met in April.
that's correct. I believe those were they were probably distributed in the April time. I don't know, Haley, if you sent them out again with the email last week.
I did. I
All right.
resent them around, so people
Okay.
should have got it
All right.
bumped back in their email.
Are there any comments or questions around the minutes from March? Okay, hearing none, can I get a motion to approve the minutes as presented for March meeting?
This
So
is
moved.
Roger. I can approve that.
All right, can I get a second?
Second.
Uh,
No, it's
Thumb-
Tamara, Jeff.
All right, it's Tamara. I was gonna say, I was like, oh man, I was looking in the wrong spot on the screen. All right, can I, motion by Roger, seconded by Tamara, thumbs up on the screen for those in approval. All right. Motion looks carried. Tika, is Tika down there? Looks, I can't quite tell.
I approve. I just can't figure out how to.
That's good. You can
indicate
verbally
that on my
approve. We'll
phone.
take it. That's good. I was gonna say, we need everybody to vote, so we'll take
Still
it.
trying to tap buttons.
We're good. Thank you. All right,
Yep.
so it's unanimous. Minutes were approved. Okay. All right. The next topic. All right. Ray, I'll let you kick us off here with this discussion.
Okay, thank you. So the equity dashboard is an original recommendation by the social determinants work group that really is broader than our group, but we're the catalyst. And you all have participated in several brainstorming sessions around, you know, what kind of data we should be collecting, and most importantly, how will the data be used to assess the degree to which we are seeing more equitable outcomes for the most vulnerable students. So that work, we're not done. We have ways to go, but we needed to get a better understanding of the process for how the resources would get to a vendor and to really take charge in helping us as professionals to continue this work. So Matt Den and I had a telephone conference with our Department of Education contact Kim Klein. I don't know her official title. Is Matt still on here? Matt?
I'm on, but I don't know her official title either.
No, I just want to see if you're on there because I need you to embellish anything that I leave out. So Kim has given us directions. The dollars were initially with the DTI state agency. They have been transferred to the Department of Education, and the Department of Education representatives will begin talks with the Data Service Center, which is a vendor that's used on a number of different research and data related projects for the state of Delaware. And so that's where we are with that. Any questions on where we are in terms of the logistics and around the business aspect of it? Kim Klein is the Associate Secretary for Operations and Support. Thank you, Terry. No questions. So we have a lot more, you know, we were given instructions to freely brainstorm all the data points that we might want to take a look at pre-K through 12. So now that we've done that, our next meeting will be asking this social determinants work group to begin to call that large list down, and so we can have a manageable scope of the phase one. I'm referring to this as phase one of the equity dashboard. So Haley will send out some questions and a matrix and ask you to say, okay, so we know that each one of us has a different set of priorities. So we need to come together and say, what are essential data points that we should be looking at? Jeff, Haley, Matt?
You know, I think the fact that we're getting closer to like a you know, somebody to kind of like take the ball from the pile of list, the Excel spreadsheet that Haley's compiled from our discussions. We're getting closer to that. I think kudos to, you know, you, Ray, and Matt for taking up that charge and really kind of tracking down where that epilogue language was and where it went and how we can get this project realized. Because this was an original recommendation from the work group. This wasn't something that piggybacked on another idea somewhere. So I do think that keeping this ball moving while it continues to be a, I'll use the word implementation, a slow implementation process, to quote Kristen Dwyer. You know, it definitely feels like we're moving forward in the right direction in the recent weeks. So kudos to the group.
Okay, thank you. It's not just the data, it's also, it really is, who is the audience for the dashboard? Because the dashboard for policymakers and how it gets depicted is different than for parents and other stakeholders. So we'll be happy. We need you to think about that as well. Dr. Lawler is sharing a great information with us around street data. People use different terminology, student agency, student voice. So it's not just all quantitative, that there's some qualitative data that's coming directly from students themselves. So Haley has been sending around information, and the latest bit of information that we've gotten is from the Education Resource Equity .org that has a framework for dimensions of equity. So we'll make sure that that you get that information. If you don't think you have it, if you scan for Haley's name, it'll come up. Any questions, or any comments? I see that Roger was on. The Reading Consortium has been collecting data specific to Wilmington students. And in hindsight, we should have been looking at this earlier. So we're not going to delve into it, but Haley's going to give us a high-level overview. We were also asked to define, what do we mean by Wilmington? It means a lot of different things to different people. And so there's a geographic map that's going to be shared as well. Roger, did you have anything that you wanted to say before we turn?
No, I'm just very eager to see where the conversation went, how the conversation evolved around defining Wilmington and the geographical area that we want to collect data. So I'm eager. I'm listening.
Okay, all right. Not just Roger, but he's the brainchild for this equity dashboard. He has
not so much.
Oh, yes, he is. Don't let, yeah.
he is. He sees he's doing a very important therapeutic work, and so he was able to make himself available today. So Haley, what is the Reading Consortium currently collecting? The audience and the goals are linked.
Sure. So I don't have to read everything on this slide, but I just wanted to reiterate to everyone that the Reading Consortium produces an annual report on Wilmington student outcomes every year. And it could be a good way to help us kind of refine some of those data points, things that we already collect. We could use that to sort of build a base of a dashboard if we wanted to. That could be one way to move forward. But so Reading does the annual report every year, and it outlines 5 years worth of data. And I think we've been doing it at least since 2014, I believe, having data that goes back to at least 2011. And we usually, our main source of data is DOE, and we have a secondary source is the school profiles published on DOE's website. So mostly DOE data. But in the report, we define Wilmington students and non-Wilmington students. So Wilmington students in the report are pre-K through grade 12 students residing in the city limits of Wilmington who attend all public schools, so traditional, vocational, and charter schools across the state. So it's some Wilmington students you'll see, they don't always attend schools in Wilmington. They attend schools in Dover. They attend schools throughout the state. So we capture that. And then non-Wilmington students are those that do not reside within the city limits of Wilmington who attend public schools. And we have a few other things that we defined, but I thought that was the most helpful for this. And so in the report, the data points that we focus in on are City of Wilmington student enrollment. So number by type of public school, enrollment by school, low income enrollment in schools located in the City of Wilmington, student proficiency in ELA and math over time. So that's helpful, and that's broken out. So it's the SBAC, so the grades 3 through 8, and then in the SATs, grade 11. And we compare that by state, by Wilmington, and by county. And I think that's what makes this report unique, is that we we showcase Wilmington students and give a spotlight of how they're doing compared to their statewide and county counterparts. We also look at, like I said, Wilmington compared to non-Wilmington, and then low income students statewide compared to low income students in Wilmington, students with disabilities compared to students with disabilities in Wilmington, as well as English learners statewide compared to English learners in Wilmington. We also look at dropout data and graduation data, doing those similar comparisons. So that's just a really high level overview of the data report. I can link it in the chat as well. Kelly Sheretz would probably be the person to answer most questions about the data report, but I can try and take any questions if folks have any.
Thanks, Haley.
Sure.
So there was one question in the chat about, are we looking at other data that's non-academic, but it impacts academic outcomes like attendance? And on our larger spreadsheet, yes.
Yes.
That there are non-academic or social determinants that are on there. So that's what I'm asking Haley to resend that out to everybody. We also asked about teacher quality and diversity in school leadership, school climate, supports and intervention. And I don't believe that we have on our list school funding, but I'm looking at this framework, the 10 dimensions for equity, this Alliance for Resource Equity, and school funding is at the top of the list.
I don't believe there's also a question in the chat from Dr. Rowe regarding childhood lead poisoning included in our data set. I don't recall that being on the list. We'll look out for that when the list comes back out, Dr. Poe, to see, or Dr. Rowe, to see where we would see about adding that.
Thank you. Haley just put the 10 dimensions of equity resource link in the chat.
Great.
That's going to be helpful for us to group like things together. So, okay, good. Haley also put the Wilmington student data report, the most recent one, in the chat.
So to Roger's point a little bit, what did the map overlay tell us, Roger, about the city of Wilmington? Like this is this was what would seem to be an easy exercise was not as easy as it was really originally proposed to be. The amount of coordination of color coding in the different lines was mind-blowing with the first draft. So we did come forward with this one here, which I'll allow Haley. She's the one who led the conversation with her folks at UD around what Ray and I talked about when we looked at the overlays. So Haley, you might recall it better than I do. I don't want to misspeak.
Sure, I can give a quick overview. I think the legend helps.
Yeah.
But the maps were created by the Institute for Public Administration, and they show the city of Wilmington boundaries with overlays of zip codes, election districts, and communities. I think those were,
Yep.
I think that's, and the other things that are shown in there, rail lines and water, but I think.
What this map took out was all the extension beyond the municipality line.
Yeah.
So like some of the blue lines ran farther off out of the city of Wilmington, some of the neighborhood, the community lines ran off, and it was impossible to understand. So we drew the boundary as the city of Wilmington, as it is a municipality. What does that look like? And this is what came back. And we felt this was the one that was most readily understandable when we were talking about what the city of Wilmington comprises. And it does split election districts as well as communities. So this is the upshot right now. This is where the map is, what we would propose for our conversations moving forward. So that's not as exciting, maybe, Roger, as you were hoping. I know you were very excited, but this is, I hope it lived up to your expectations.
It does. And I think to the question of the intended audience, I don't know if we arrived at a closer answer. I mean, I think this is a map that, thinking about the various stakeholders, is this something that, parents could take a look at, researchers, policymakers? So I'm not sure where we landed in terms of who would be the primary audience, and who do we expect to, like, the main stakeholders, and just in terms of viewers of this dashboard.
That does, you're right. It goes back to the broader question of the dashboard and this having value for those audiences.
Yeah.
So we haven't landed. What are your thoughts?
I mean, I think if we have a robust enough, I love the dimensions of equity. I think those align pretty well with some of the initial thoughts that we had about what could we include. And I also think that why completely reinvent the wheel? This data that the consortium has been collecting could be like the foundation. And I think we just align it with each of those areas, those equity areas. I do think that it matches pretty well the vision that we started with. And so if we were to decide on what are some of the metrics that could be collectible, that are both things that are quantitative and qualitative, like you mentioned, Ray, and how, so I think if we have a robust enough dashboard, then it's not really, this is for parents, or this is for, researchers or policymakers. I think if it's rich enough, multiple audiences could take advantage.
Yeah.
So.
Yes, I agree.
Okay, so that was we wanted to, again, bring back just an update where we are with the data dashboard discussion, wanting to give more attention to the legislation, because it was a priority tonight to bring, so we could bring that forward to the full body consortium. At this point on the agenda, we have opening up for public comment. Before I get to that, did any other consortium members have anything to add or questions about the data dashboard? It is going to continue to be obviously part of what we focus on, but we're still in the process of that, as Ray had said, that conversation with DOE and a vendor to kind of help move the work forward as we refine our data set that you're going to get from Haley, or she can put in the chat a link to you to grab it where we are.
Jeff, I can share my screen with the metrics that we sort of collected during the brainstorming session now. I don't know if that's helpful for folks.
I wanted to be respectful of our time, knowing that we were coming up on 6 o'clock. And so I didn't want to, I think probably sharing just the email, and I believe do we have one more meeting scheduled for this group in June? Or I can't remember.
I don't think we have it on the calendar yet, but we can.
Well, can we, because like 90% of you guys are school people. Should we meet in June or should we skip June and meet in July? I'm not sure what your
So if it's in June, it's going to be like right on the heels of most districts are wrapped up and getting ready for summer programming. If you're talking about school-based educators, in terms of DOE, I don't know their cycle well. I don't think June 20th would be out of the realm of possibility for a meeting, because I do think there's a lot of PD that's going on in that time. I would agree with Tamara. I think June would be a nice touch point for this data conversation, bridge us over the summer, where July and August we probably wouldn't meet, and then we'd pick back up again in September like we did last year.
okay, you know, whatever your pleasure is. I'm just trying to be compassionate.
Oh, Ray, you saying I'm not compassionate? Wait a minute.
No,
You're
no,
just
no, no.
telling-
I'm trying. No, I'm trying to be compassionate to school people. I go to meetings all the time, and people are like, "Oh, we know what school leaders and school teachers are up against," and then they just do things that fly in the
Yeah.
face of that. So that's why I'm asking.
Oh, I know. I'm kidding.
So it seems like you all want, well, the people that weighed in and the rest of you that are silent. So you know, that we'll meet in June and then we'll take off in July. If you are opposed to that, let us know.
Great. All right. That said, we want to get to public comment. I see Dr. Rowe has her hand up. And so we ask that you limit your comments to 3 minutes. And Dr. Rowe, the floor is yours.
Thank you. I am the chair of the Childhood Lead Poisoning Advisory Committee Subcommittee on Data. And so I would be very eager to work with you to ensure that lead poisoning is included in your data set. I think that is one of these critical social determinants of health, and I'd really like to see that information included. There's some updates to lead poisoning that I think are very critical for understanding. I'm just going to run down my list. The CDC lowered their definition of childhood lead poisoning, their blood lead reference value in October to 3.5 micrograms per deciliter. That's going to significantly contribute to an increase in the number of designated elevated blood lead level cases in the state. The state of Delaware currently has regulations open for public comment that interprets what an elevated blood lead level means. That is in the Delaware Register right now, the May edition in the regulations 4459A under the Department of Public Health. I have, along with my colleague Sarah Bucic, already submitted some comments on that. So if you would like to have a copy of my comments, I'll put my email in the chat and forward those comments to you. The Primary Prevention Subcommittee on the Childhood Lead Poisoning Advisory Committee is meeting Thursday at 10 a.m. That's a very clear tie to social determinants of health in reducing elevated blood lead levels. And then the final thing that I wanted to mention is that in July, the Interagency Coordinating Council may consider lowering the eligibility threshold for early childhood education interventions for lead poisoning cases to 3.5 micrograms per deciliter to match the new blood lead reference value by the CDC. And so that is something that you may want to be involved in. I'll put my email in the chat if you'd like a copy of my comments.
Thank you, Dr. Rowe. Okay.
Thank you. Very, very informative.
All right. Next, I see Julie Bieber. Again, you have 3 minutes, Julie, and the floor is yours.
Hi, everyone. I just wanted to say thank you so much from a Reading Pre-K provider program, Kingswood Community Center. Thank you so much for listening to our suggestions and for changing some things about the Reading program to help it align with ECAP. I would just like to say too that one of the things that we've spoken about, and we had a great meeting with DOE where we would love to see one unified system. So rather than a separate ECAP and Reading system, we would love to see one system. And I believe Ray spoke about this in the past too, so that parents or families don't have to worry about which system their child is being enrolled in, under which grant. To them, they're just receiving high quality pre-K services. And to them, that's the most important thing. As a provider, that's the most important thing for us as well. One of the things that we would love to see is we would love to see Reading be the standard for the entire state. Rather than having a separate ECAP and Reading program, we would love to see one Reading program with emphasis on the city of Wilmington, but being able to serve the entire state.
Thank you, Julie. Okay, I see Lucinda Ross, her hand is up. Lucinda, you have 3 minutes. I see you
Thank you.
wrote something in the chat, but you
I
have 3
did.
minutes.
I did write something in the chat because I am enjoying the pollen count in the state of Delaware right now. So I don't know how much longer I go without coughing, but St. Michael's is thrilled to have received Reading slots this year. And I would actually echo exactly what Julie has said, that aligning it and simplifying Reading as the kind of the standard for ECAP as well just seems to make terrific sense. I will say that, and I just want to give kudos to folks on this call that helped us navigate these waters the first year, but it is a heavy lift. And having talked to other providers, it was not just being assured that all that work is going to last for another year or 2 or 3 or 4. It also was simply the logistics and the services involved. Like I said, St. Michael's is a pretty large program, but we still did not have all of the administration that we needed and had to do much juggling and organization. So I think that, perhaps even looking into what the sports system will be for new programs coming in. I was very fortunate to have Dawn on, my quick call and Julie always answering the phone. And I think that setting up those kind of mentoring programs is something I really recommend doing as well. So thank you all. I'm thrilled to be part of this group, and St. Michael's is really happy to be part of it as well. It's what we want to do.
Thank you, Lucinda. Appreciate the comments. Haley, did you get any messages in the chat for any further comments? Nope.
Nope, I haven't seen any more.
All right, that said, it's right around 6 o'clock. Ray, do you want to give the honorary motion to adjourn as you? So we have a motion to adjourn.
Thank you, everyone. We had great participation for this meeting. Highly engaged. It's all of us together thinking and then taking it out to other people. So we really appreciate it. So Jeff is looking for a motion. Okay, I'll make the motion. I move that we adjourn.
Second.
There we go. All right.
Thanks,
Thanks,
everyone.
everybody.
All right. Take care, everyone.
Thank you.
Bye. See you in June.
Thank you.